Hello and welcome to Pregnancy Info. If you are still breastfeeding an old child, you may have a few questions. Is it possible to continue breastfeeding while pregnant? Is breastfeeding while pregnant safe or both my current and future child? How will this impact my milk supply? Don't stress. Whether you choose to continue breastfeeding or want to start to wean, we have got the information you need. First question you ask is that, is it safe to breastfeed while pregnant? Yes, it's safe to breastfeed while pregnant as long as it's a healthy pregnancy and you are consuming enough calories for yourself, your growing fetus, and your breastfeeding baby. An American Academy of Family Physicians points out that breastfeeding during pregnancy is not unusual and the decision to do so should be left up to the mother in a healthy pregnancy. Another question you ask is, will pregnancy affect your milk supply? It's very common for pregnancy to reduce your milk supply. This generally occurs around the 4th and 5th month of your pregnancy. The composition of the milk will likewise usually change slightly because these changes are caused by hormonal shifts. Extra pumping and feeding will not usually increase your supply as it normally would. Another question in your mind maybe is that, what about colostrum? You may also wonder whether there will be enough colostrum for your new baby. Colostrum will still exist for your newborn, no matter how much your older child feeds. Still, to ease your concern, consider offering your newborn the first breastfeeding at each feed. Now, there are some risk factors for breastfeeding while pregnant. If breastfeeding is safe, you may wonder why some women decide not to breastfeed while pregnant. To put it simply, being pregnant can be exhausting and uncomfortable in itself, and continuing to breastfeeding during pregnancy can heighten the physical and emotional challenges. If you are pregnant and breastfeeding, you may discover that you have sore nipples, nausea, fatigue, a feeling of being overwhelmed, a decreased milk supply, changes to your breast milk, the color, consistency, and taste may change, contractions, which is also responsible for preterm labor. So there is a risk of preterm labor from these contractions is small. If you are concerned or have experienced miscarriage early deliveries in the past, you may want to discuss this with your OB/GYN. Here are some benefits of breastfeeding while pregnant. There are plenty of benefits that cause some women to choose to continue to breastfeed. Some of these include: number 1, immunity boost. Immunity boost and nutritional gains for your currently nursing child that continue as long as they drink breast milk. Extra bonding or attachment opportunity with your child during your pregnancy, especially when you are feeling fatigued, or breastfeeding can be a relaxing way to spend time together. Promoting feelings of safety and security in all the children during times of change. Helping reduce symptoms of engorgement after the baby arrives thanks to your experienced nurser. A solid milk supply thanks to Tandem feeds plus breastfeeding them at the same time can keep older sibling out of trouble while you nurse. Now we will tell you some tips for breastfeeding during pregnancy that will help you in this process. Number 1, check with your doctor or midwife first, but breastfeeding during pregnancy is generally not an issue, though in some situations, such as when you have a history of premature births caused by your cervix dilation too early or signs of premature laboring during this pregnancy or unusual bleeding, your doctor may recommend weaning. Number 2, for some women, morning sickness seems to be aggravated by nursing. If you are one of those, try keeping light snacks handy when your toddler comes over to nurse. Eat a few crackers or a piece of toast to ease any nausea. In severe cases, you may need to work towards complete weaning. Make sure you are eating well. Your body is helping to sustain a toddler and a growing baby, so good nutrition is crucial. 500 extra calories needed if your breast milk feeding child is also eating other foods, or 650 calories needed if he or she is under 6 months old. This is the addition to the 350 extra calories needed if you are in the second trimester of your pregnancy, or the 450 extra calories needed if you are in the third trimester. So keep in mind that these nutritions are important for your good supply of milk. Be prepared. Sore nipples. It is very common during pregnancy. pregnancy, most mothers find this easiest to deal with by keeping feedings short depending on the age of your toddler. You may be able to negotiate this. As your milk supply decreases, your toddler will need to have more foods and drinks added to his diet to compensate. If your toddler always nurses to sleep, you may want to begin introducing some other approaches to sleep. To that, it will be easier when you have the new baby. As your belly grows, you may find you need to experiment with new positions. Side lying is often good. Your toddler may also be willing to sit or kneel or even stand beside you in nurse. Talk to your toddler about sharing his mom with the new baby when it comes. Many are very resistant to this idea. One toddler told to his mom, when the baby comes, grandma can give it her milk, but most come around once there is an actual baby. It's important for the new baby to get a good dose of colostrum. So in the first few days after the birth, you may want to limit the toddler's feeding and try to always nurse the baby first. This will help him to consume maximum colostrum. Don't be surprised if your toddler, who just days ago was a little baby, suddenly seems huge once the baby arrives. You may even feel a bit annoyed when the toddler wants to nurse, in contrast to the cuddly, loving feelings you feel when nursing your newborn. This is common. Some toddlers are delighted when your milk supply increases dramatically a few days after birth. Others have gotten used to a lower supply and may even wean because they don't like getting loads and loads of milk every time they nurse. If you can get to know some other moms who are also tandem nursing, they will be able to give you some perspectives as well as practical tips of coping with some of the more challenging moments. Remember, most toddlers feel some jealousy towards the new baby and may regress in behavior or show anger by acting up. So this is all about the risks, benefits, and tips about breastfeeding in pregnancy. Share this video with the females who are started a new pregnancy while she is breastfeeding to her toddler. This will help them a lot, and must share your opinion in the comments that how you find this video. Thank you.